Hello everyone and welcome to Crash Course Biology. On this week's episode, we are learning about the heart. So the heart is a muscle located in between your lungs, somewhere in the center of your chest. It is a muscle which is responsible for pumping blood throughout your body, and it is one of the most important organs in your body. Fun fact, the heart is the first organ to form in a baby developing in the womb. So the heart is an integral part of your circulatory system because it is responsible for pumping the blood which transports oxygen, carbon dioxide, nutrients, and hormones to the muscles, tissues, and cells in our bodies. Without the heart, the circulatory system would be unable to circulate these substances to our bodies, and our bodies would be deprived. So, to understand the structural functions of the heart, let's talk a little bit about the path of blood as it flows through the chambers of the heart. So blood begins in the superior and inferior vena cavas, and they come into the right atrium. From the right atrium, the tricuspid valves open and they go down into the right ventricle. From there, they move through the pulmonary arteries to the lungs because this is deoxygenated blood. So they go to the lungs to be oxygenated. Once they have picked up the oxygen, the blood moves through the pulmonary veins back to the left atrium, which then the mitral valve opens and allows the blood down into the left ventricle. From the left ventricle, the blood is pumped through the aorta and out through the rest of the body. So the important things to remember is that the heart is divided into two sections, the right side and the left side. The right side is responsible for pumping blood to the lungs, and the left side is responsible for pumping blood to the rest of the body. The two sides are divided by a wall called the septum, which is responsible for ensuring that the oxygenated and deoxygenated blood do not mix. So in this animation, we are able to see the pumping of the heart as well as the opening and closing of the tricuspid and mitral valves. So one illness which may affect the heart is coronary artery disease, which is more commonly known as simply heart disease. So coronary artery disease is the narrowing or blockage of the arteries due to a process called atherosclerosis. Atherosclerosis is the buildup of cholesterol and fatty deposits within the arterial wall. For people with high blood pressure, the constant extra strain on the arterial walls will eventually cause a tear. Due to the tear, inflammation will be caused within the arterial walls. Substances which are responsible for responding to the inflammation, such as white blood cells, will then start to gather around the tear. Fat and cholesterol floating around in the blood will also begin to build up and form a plaque which thickens and stiffens the arterial walls. If the inflated tissue ruptures, a blood clot will also form, further narrowing the already clogged artery. So this disease physically restrains the blood from reaching the other sides of the arteries and from reaching the heart. Therefore, the heart will be deprived of the oxygen and the nutrients which are carried in the blood. Eventually, coronary artery disease can cause severe chest pains, scientifically known as angina, or even in severe cases, a heart attack. Causes of coronary artery disease. Coronary artery disease can be hereditary. So for someone, for example, if you have a genetically high blood pressure, artery inflammation can begin for you at a young age and plaque can develop very quickly. However, an unhealthy lifestyle can also lead to CAD. Factors such as high stress, which can cause high blood pressure, which can lead to damaged arterial walls and eventually CAD. A poor diet, which consists of high in trans fats, cholesterol, salt, and sugar, can also cause high blood pressure, which can eventually lead to CAD. And lastly, smoking. So right off the bat, some easy ways to reduce the effects of CAD and prevent further damage would be to improve your lifestyle. So reducing stress, reducing intake of foods high in trans fats, cholesterol, salt, and sugar, and quitting smoking. So a piece of technology which we can use to diagnose coronary artery disease would be coronary angiography. A coronary angiography uses dye and special x-rays to show the insides of your coronary arteries. With this device, we can see areas of restricted blood flow due to artery inflammation, which can help us indicate coronary artery disease. Thank you so much, everybody, for watching. I hope you learned something about the heart. See you in next week's Crash Course Bio.